Do you take antihistamines? Do you need to reduce that inflammatory response in your body from allergens, from food? Well, guess what? Histamines by Designs for Health is a great natural product to reduce the histamine load. In this time of year, in the spring, it's seasonal allergies, but it's also irritations to the gut when you eat tomatoes or chocolate or cheeses that have been aged for a long period of time. They're all high in histamines. Do you take Benadryl at night to go to sleep? That's a histamine issue. So something as simple as histamines can make a huge difference for you in managing hypersensitivity of your immune system. If you need it, that's our job. Give us a call. But if you have any of those systems related to allergy type symptoms or inflammation, this could be the ticket. Hi, I'm Dr. Donald DeFabio, and welcome to Fabulous Feasts, where we talk about food as a way to regain, maintain, and perhaps restore you health. Remember, you are what you eat, so you want to eat high quality food, and as Hippocrates said, let medicine be thy food and food be thy medicine. So we're going to talk about healthy eating choices, and today it's all about Italian comfort food. Yeah, Italian comfort food that's healthy. It's going to be great. Old school classic from my family called chicken and peas, and it starts with some chicken. But first we got to get the pan heated up, so we'll turn the pan on. Let's get a little bit of heat going. Now remember, you want to get a chicken that ideally is free range. You also want to get a chicken that you got to read the website of the company that makes the chicken, that grows the chicken. Do they let them roam around? Are they cooped up? Do they have best practices? Are they vegetarian fed, or are they fed other things? You want vegetarian fed. You want free range. Organic, that's always great, but we always don't have that option. If there's a local farmer, get it from them. So I have chicken breasts today, but you can use whatever type of chicken you want. And we're going to just, I sliced them into medallions, kind of like a filet mignon. 1.5 inches, 2 inches thick, straight down the breast. On top of that, we're just going to add a little bit of salt and a little bit of pepper. Now, I also let the chicken come to room temperature. If you find your chicken's tough, it's tough for two reasons. One is that they're really not letting the chicken in the slaughterhouse age at all. They're not letting it rest 2 to 3 hours after they slaughter it before they package it. That aging of 2 hours just starts the enzymes in the meat to start to make it softer. They can age it, but most of the time they slaughter it and they pack it right away, and it makes the chicken a little tough. So if you're running into that, first thing you need to do is let your chicken come to room temperature. Don't cook it when it's cold, because that tightens it up too. And the other one is pound it, okay? And let's, use a little tenderizer just by pounding it. Now you have to put some oil in the pan, 2-3 tablespoons of olive oil, because the chicken's white meat, it's not going to throw off any fat. And you put it in, and you got to let it sear. And you can see there, I call them medallions, like almost mini filet mignons, so to speak. And you're going to sear it on both sides. So we're going to put this in. And if I place these last two perfectly, there we go. Make that 3. We'll get a nice sear on them. And salt and pepper are nice flavors, but that's not the only flavors we're going to be using. The next thing I want to add into here are just a couple of crushed cloves of garlic. Leave them whole, okay? So as they cook, they'll impart the flavor, but you'll be able to leave it in there the whole time. That's going to take probably 4 minutes to 6 minutes on each side. Let it sit so it gets that nice sear on it and crust, and then flip it over. And then we'll add a little bit more seasoning, and you'll see how easy chicken and peas is to put together. And once it comes out, yeah, it makes your tummy feel good. So as this is cooking, you know, I want to tell you a quick story from my patients. Another patient was in the office, and they were preparing for a surgical procedure, actually a vascular surgical procedure. And they were wondering what they can do to prepare. It's a 4-hour surgery. And I said, well, number one, let's make sure you're cardiovascularly fit. Let's talk about walking. Let's talk about treadmill. Let's talk about exercises you can do that are safe to make you a little bit stronger going in for your surgery. That same patient, we found out that he had a lot of weakness in his legs, and one leg was dramatically weaker than the other. And it was like, gosh, how did that happen? Well, it's called life. But isolating these simple things, we had a discussion on what can you do to prehab. My patients know we're big on rehab. We're big on exercises. We're always helping you do things at home as well as in the office to help you hold your adjustments better and to get better faster. But in this case, it was to help with recovery. And look, our athletes know we're all over recovery. We have the Normatec boots for recovery of the legs or the shoulders for the athletes. We use the percussion devices for recovery, the foam roller, the stick. Those are all recovery tools. Our laser, a recovery tool. The radial pulse wave, a recovery tool. Those athletes know all about that. But prehab is a whole different animal. It's making you as strong as you can so that you'll survive your procedure better, whether it's a knee replacement, hip replacement, or in this case, a vascular surgery. And it's going to help you be stronger going in, which means you're going to be stronger coming out. It's prehab. So if you need any prehab, ask. Let us know what we can help you out with. Because it's not what we treat, it's how we treat. And prehab keeps you going into a procedure, into a surgical procedure with as much health and wellness and vitality as you can. So you can see we're getting a little bit of a sear on the chicken. Going to need a touch more. This piece I think is ready. It's a slightly thinner piece. Yeah, that's nice. So I'm not going to try to flip it too much. I want to get that really good sear on it. Just let the garlic do its thing. You know, another service that it falls into that whole rehab and prehab, there we go, nice browning on it, is our windback therapy. Windback therapy is very cool. On top of the chicken right now, I'm going to add a little bit of oregano. Not too much, just a little bit. We've already had salt and pepper. Now we're going to get some oregano. And for a couple of reasons. Number one, it's going to give it a nice flavor. Number two, the oils of the pan and the olive oil is now going to start to bring out the oil in the oregano. And you know, oregano's got a little bit of a pungent taste to it. Foods that have the pungent taste like that are high in antioxidants, very good to boost your immune system. Rosemary, oregano, get that little bite to them, so use them as much as you can. As I was just saying a moment ago, some of our patients have noticed we have this new piece of equipment we keep rolling around the office. Ooh, that's nice. It's called windback therapy. It's an electroconductive therapy that stimulates the body to heal itself 3 different ways, and that's why I love it, because that's what chiropractic's all about, stimulating the body to heal itself. And it does it at the cellular level. Oh, perfect. It causes the cells to have increased membrane fluidity. The cells need to get nutrients in and waste products out, and that membrane has to have a certain degree of give to it. Windback therapy improves that give, so nutrients get in better and waste products come out better. It also can create a little bit of deep heating, which can be beneficial for some people to relax tight, taut muscles and joints. We can do it. Oh boy, that's nice. There you go. And we want all those little bits of chicken sticking to the bottom of the pan. You can see how they're sticking a little bit. When we deglaze the pan, with our comfort ingredients, you're going to see all that flavor come right up, and then it's all going to marry together. But we can use the Wimback passively, just putting it on somebody's back or neck or shoulder, but we're finding using it while the patient's moving is doing great results for arthritic joints, great for chronic pain conditions. So we actually move the patients around while we're doing it. Other times we can put bracelets on our hands and have the heat and the electroconductive therapy come through our hands while we're doing adjustments. Another cool way of using the Wimback therapy. And most of you probably don't realize what I'm talking about, because we're one of the few places in New Jersey that has this technology. It's very new to the United States. I'm aware of it because as a sports doc, my athletes are always asking me, "Hey doc, what's new? Hey doc, have you heard about this?" I can't tell you the number of times an athlete has come in and asked me about something that's so new that it's like, I gotta go look that up. Well, this time I beat him to the punch. I found out about the Wimback, brought it in before everybody else did. So now you can see garlic's got a little brown to it, which is okay. We like that. We got a nice sear on our chicken. I'm going to add just a touch more black pepper. Already has oregano. And we're going to deblaze the pan with a can of low salt sweet peas with the juice. With the juice. Pour that right in. Cover it. Lower the heat, because we don't want this to cook hard. We just want it to simmer now. 20 minutes, let that simmer. Occasionally give it a stir halfway through, and I'm going to show you how we can serve it up in a nice, healthy way to have some Italian comfort food that's anti-inflammatory and good for you. All right, we stirred it once. Let's come back and see how it looks. You know, I don't know how it looks, but I'll tell you one thing. It smells great. The oregano, the peas, it is just fabulous. And you can see now it's got a nice little, not gravy, but sauce, just from the water from the peas out of the can. And, you know, if you are one of those people that likes their chicken falling off the bone like my dad, just keep it on a low heat and just let it simmer. If it starts to dry out, just add a tad of water. But this is perfect. Now, what we're going to do for a serving suggestion is to take some roasted portobello mushroom caps. And that's going to be the base for our chicken and peas. You know, we grew up on chicken and peas, and it is just brings back so many memories. Did my mom serve it over portobello mushrooms? No, she didn't. We would have it with fresh sliced tomato and mushrooms. I'm sorry, and white potatoes. But you know, white potatoes are a little high glycemic index. They're a little high in glycemic load. So I really try to avoid that. So you got to get your veggies. I'm going to eat the garlic. I like it. If you don't like it, just leave it in the pan. That's the other reason I leave it whole, so people can eat around it if it doesn't agree with them. Sidebar, if onions, if garlic kind of don't agree with you, talk to us about it. That means you're not digesting something properly, and it can be fixed with some simple nutritions and maybe an adjustment. We have a special adjustment for the gallbladder and the stomach. So that might be it, but it's usually a digestive issue which can be simply fixed. So if you're one of those people and you want to get back to eating onions and garlic because they repeat on you now, let us know. So there you have it. Peas and chicken and peas on portobello mushrooms. And if you want to add a little anti-inflammatory kick, we're just going to sprinkle some hemp seed hearts on the top. And, you know, since this is now a cooking show, it's not just a health and wellness show, we got to put a little sprig of parsley on it for you. I'm Dr. Donald DeFabio. Thanks for tuning in. We appreciate it. And, yeah, if you have any questions, just give us a call. But enjoy chicken and peas on portobello mushrooms. Have a great day. Brain health. Are you looking to improve your memory? Well, number one, eat berries. Number two, decrease systemic inflammation. So diet, nutritional supplements. And what supplements specifically are good for brain health? Antioxidants like resveratrol. Vinpocetine is another one. Hertzperzine is another one. Those are all bound together in Memorol by Zymogen Labs. So if you're looking for an immune and brain boosting supplement that's going to kind of balance both of those things at once, Memorol is the way to go. My family recipe that I want to share with you that reflects our heritage and culture has got to be Pop's baked baccala. It's one of his 7 fishes recipes from our Christmas Eve celebration. Let me share it with you. It starts with baccala, which is a dried cod, which needs to be soaked in water to get all the salt out. And you cut it into nice portion-sized pieces. Put it into a casserole baking dish and line it up nicely. At that point, we're going to add a little bit of olive oil, maybe 2 tablespoons of olive oil, and a 1/4 cup of white wine. Now you have to remember, baccala's cod, it was dried, it was salted, and then you rehydrated it with water. Now it's just looking for flavor. So baste it in this olive oil and white wine. Let it soak up all that goodness, and the flavor will really start to come through. On top of that, we're going to add some oregano. Oregano is the only pungent flavor ingredient in this dish. Everything else is very sweet. And it starts with sweetness with these sauteed onions we have here. And boy, they smell great. The caramelization's coming out. A little onions on each piece as we're building the flavor. The next thing we're going to do as we build the flavor is we're going to add some raisins. Raisins will also, put that down. Raisins will also give it a little bit of sweetness, and each piece gets personal attention. On top of that, we're going to add some San Marzano tomatoes. And then from the San Marzano tomatoes, we get some breadcrumbs, put it in the oven, 325, baste it after 15 minutes, and it's done in a half hour. Let's talk inflammation and supplements that'll help you manage inflammation. Essentially, inflammation falls into 2 categories. You have acute inflammation from an injury where you get swelling along with the inflammation. And then you have more chronic inflammation, and that's from eating poorly or micro trauma, small trauma over time. And we need to look at these things a little bit differently. Can you use both supplements together? Of course, but let's talk about them separately first. For acute trauma, I like Zymane by Zymogen Labs. Been using Zymane or versions of it for 35 years. They're called systemic enzymes or proteolytic enzymes. They're extracts of pineapple, bromelain, trypsin, and what they do is they reduce the amount of the protein exudate, the proteins that cause swelling. So you take them on an empty stomach, very important. And if you are taking systemic enzymes, make sure they're enteric coated. We don't want these to get broken down in the stomach. Then they become digestive enzymes and they break down food. So taken on an empty stomach and enteric coated, excellent for acute inflammation with swelling. Chronic inflammation is a different story. There I like ProEnz by Anabolic Labs. ProEnz is all herbal. Ginger, rosemary, boswellia, frankincense, herbs that reduce inflammatory markers in your body. They're COX-2 inhibitors, like a natural Advil, so to speak. Gentle, you can take them with or without food, and it mitigates, it reduces the inflammatory response in your body. Take it every day is what you do this for, the ProEnz, everyday use. The Zymane is usually just a couple of days, 5-6 days when you're acutely inflamed. Some of my patients take it on a regular basis after a hard workout or something. You can do that as well. So you have acute inflammation, Zymane, you have chronic inflammation, ProEnz. Together, it helps control inflammation, which is an itis, which is an osis, which is neuritis, gastritis, diverticulosis, arthrosclerosis. It's everything. It's pain. So you need to suppress inflammation for chronic disease as well as for acute injury. That's how we do it here in the office. Let me know if you have any other questions. Today's show is a show about veal. We're going to do veal and peas. And we're going to talk a little bit about veal because I'm really excited to talk to you about the not only nutritional value of it, but how you can get a healthier type of veal out there today. Beyond that, we're also going to pair it with some nice squash, a little delicata squash, and a wonderful salad with 3 colors, which is what I like to do. So first of all, let's talk a little bit about veal. So if you see here, I have some very nice veal scallopini. Now, it's reddish. It's not that whitish. It's that reddish. This is Strauss veal. And I'm really excited to use them because they do a couple of things that are really different with their veal. Number one, it's raised in pens. So they're allowed to walk around. They're allowed to roam around. Now, if you remember the show where we talked about chicken, some producers of chicken, they're so cooped up, their legs aren't developed at all. They just sit in their own excrement. Veal, when it walks around, when these cows walk around, when these calves rather walk around, they get to play with other calves. They're in open pens and they're fed way from local dairy farmers. So it's interesting. You hear about prosciutto di Parma. It's one of the finest prosciuttos in the world. What are those pigs fed? They're fed whey from the local farmers. So that whey that's local is really healthy for the calves. And not only that, they're humanely raised. And that's why the color is more red. There's more iron in here. In fact, Strauss Meats checks the blood of their animals to make sure they have enough nutrients and iron coming in. And of course, it's raised without antibiotics or preservatives and things like that. So I'm really excited about their product line, and that's why it's humanely raised, and I love it. Now, the veal scallopini, I pound it, okay, to get it nice and thin. And we're going to cook it with some peas today. But even though it comes sliced thin, you still have to take a look at it because some of the slices might be a little too thick. So this slice is about 3/4 of an inch thick. I'm sorry, 3/8 of an inch thick, almost 1/2 an inch thick. So we have 2 options with fixing that. One is if you have pretty good cutting skills, get a really sharp knife. And I'm going to take it off the saran. We'll talk about the saran in a second. If you have pretty good knife skills, you can take it and get it to that 1/8 inch thickness. Now this is a little challenging. It takes a little effort, but you do have to make sure if you want to have a really nice scallopini that it's thin. The other way you can do it, and that's a nice thin veal scallopini. The other way you can do it is to put it on a piece of old school saran wrap works best. The new cling wrap doesn't work as well. Cover it up, get out your thumper, pound it. By using the saran wrap, it spreads nicely. When you're doing it just on your cutting board, it'll have a tendency not to really spread out. So wrapping it in saran works really well, and pound it so you get to that level of about 1/8 of an inch or less. All right, that's a little bit large than what we want for this dish, so I'm just going to cut it in half. I'm going to put those over here, and I'm going to get rid of my meat. So I'm going to take the whole cutting board and put everything in the sink. Nutritional supplements are safe. I'm Dr. Donald DeFabio, and I want you to realize that only 25% of people who take nutritional supplements actually consult with their doctor about what they need, how much they need, and should they be taking them. So yes, they are safe, but what do you need in terms of a nutritional supplement? Because I'll tell you right now, the most expensive nutritional supplement is the one you don't need. So talk to your doc about what you need. And if they aren't familiar with nutritional supplementation, find somebody like myself who is familiar with nutritional supplements, diet, and lab work, and what works best for your individual needs. It's pretty straightforward, takes a bunch of brain work, takes a lot of time on the doctor's part, but for you, it's money. Money, health currency. It's feeding your bank of health currency to keep you healthy and prevent disease. I'm Dr. Donald DeFabio. Thanks for tuning in. Delicata squash. We're going to prep this first because when this gets done, then the veal will be done. Everything will be done at the same time. So let's rinse the squash. The reason you make sure your delicata squash is washed because the skin's edible. So we're going to cut this and use it and leave the skin on. So make sure you make sure you wash the skin. Trim the edges. And you're going to slice it long ways. And it's like any other squash. It's going to have some seeds in it. So take a spoon, scoop out your seeds. Now, if you're somebody that likes eating pumpkin seeds, and you every now and then get them at the store, guess what? You can roast these seeds too. So scrape them out, rinse them off, throw them in your oven or toaster oven for 15 minutes or so, not even. They toast up real quickly. If you want to season them with salt or with cayenne, if you like them spicy. But you can eat these seeds just like a pumpkin seed. Just rinse off the little membrane that they're attached to. So since I like that, I'm going to save those for later. Take your delicata squash. This is really important that you slice the pieces even thickness. I go about 3/8 of an inch, not quite a half an inch, because we want it all to cook evenly. So let's slice those up. And then it's a very simple roasting. It's just like roasting any other vegetable. Toss it with a little bit of olive oil, a little salt, fresh brown pepper, black pepper, and then put them in a roasting pan, relatively high, 350 degrees. I'm sorry, 450 degrees, a little bit of olive oil, not much. A little bit of salt, pinch of pepper, because that's the way I like it. Toss them around. And it's a roasted vegetable, but the cool thing is, by the time this is done, our veal will be done and everything will be ready at the same time. Grab your roasting pan, lay those down, nice even sheet. In the oven they go, 450, and nice and crisp. Usually takes about 15-20 minutes, not that long at all. So let's go to the veal now. In our frying pan, let's turn it on. Not too high the heat. Higher than that though. Yeah, medium heat. Touch of olive oil. Now, I've already pounded the veal, and I like the sizes relatively thin, but I want to get the oil warmed up, get the pan warmed up a little bit, because we want to get a little bit of a sear on, we can just put this over here for now. I want to get a little bit of a sear on the veal. So we're going to sear it up first. Just get a little bit more heat on that. And we'll start with just a little bit of garlic in there. About 1 clove, not much. And let's get that veal going. This won't take long. We're going to get the veal cooking. Then we're going to take it out deglaze the pan. And then after we deglaze the pan, we'll add the tomatoes and the peas. And guess what? You got veal and peas. One of the things people are concerned about with eating red meat is that it's a saturated fat. First of all, you know, veal being raised on milk, and especially this veal on whey, it's got a lower fat profile. Also, what's important is the vegetables that go with it. Your vegetation is where you get all of your anti-inflammatory nutrients. So you're going to see we're going to pair this with a squash and with a salad. So that's really important to get your vegetables in. 5 to 7 servings of vegetables a day are really essential. Yeah, 5 to 7. That means not just, you know, this much lettuce on your salad. It means a salad this big and this much of the protein and other grains is the real problem, because grains drive inflammation. All right, there's two things that are going to drive an inflammatory reaction in your body. One is the amount of omega-6 fatty acids you have in your system. Omega-6 fatty acids give you inflammation, and they are found in grains and in foods that are fed grains. So you got to make sure that when you're using a beef or a veal, that its source of food, its nutrients, is grass. And the Strauss family uses their meats as grass-fed, which is great. Also, it's the amount of sugar content, the glycemic index, how quickly your blood sugar flares up and after a meal, and how long it stays up after a meal determines how inflamed you're going to get from that meal. So you want to eat foods that keep your blood sugar level. How do you do that? Well, number one, you stay away from white flour and white sugar, of course. You stay away from foods like white potatoes, which spike your blood sugar really high and keep it up for a long period of time. And you eat more foods that have high fiber. Vegetation, above ground vegetation, green leafy vegetables, celery, asparagus, bok choy, spinach, things like that have a lot of fiber. When you have a lot of fiber in your diet, it helps maintain that glycemic load from that being more level. You don't get those big spikes. So those are two simple ways you can help keep your blood sugar level with everyday eating. Now I got my veal in. I'm going to leave it. I'm not going to keep messing around with it for a couple of reasons. I want the heat to transfer from the pan into the veal. Every time you pick it up and flip it over, pick it up and flip it over, you're letting cold air get underneath that meat, and it's going to impact the cooking. All right, so, and also I want to get a little bit of a sear on it, so I'm just going to let it cook. It's throwing off a little bit of water, which is fine, but that's just got to do its thing for a moment. Once that browns, then we'll be able to swap it out and start making the sauce. Then we put it all together and we'll be in good shape. Thank you for watching Fabulous Feasts. Now, really the question becomes, why am I, as a chiropractic doctor, talking about food and teaching cooking? That's really not what I'm trained in. I mean, I love to eat. We've always been brought up respecting our food and eating high quality food as a child. I mean, that's one of the things my dad always told us. You know, eat the best food you can. If you need to save money, you can save money in other parts of your life. But when it comes to eating, buy the best food you possibly can. So I've always had that concept, but again, I'm a chiropractic doctor. I deal with the spine. As a sports doctor, I deal with the shoulder and the knee, the ankle. They call me the other foot doctor. We see so many foot problems. So where does food fit in? Well, it fits in because diet is one of the 5 factors of health. Now, when we say health, what do we mean? Well, let's define it. Health is defined in Dorland's medical dictionary, in the medical dictionary, as 100% functioning of the body, not merely the absence of infirmity or disease. It's optimal physical, mental, and emotional well-being. That's the definition of health. So that's what I do as a chiropractic doctor. Without medication, without surgery, with natural interventions, adjustments, and diet and supplements, it's all about getting your body to reach optimum physical, mental, and emotional well-being. That's why diet is so important, because it's like your car or an airplane or a race car. If you put in high-test fuel, you're going to get better efficiency, you're going to go faster, you're going to get better combustion. If you work on regular gasoline and you're put in diesel, not a good choice. So you want that highly beneficial nutrient source for your body. Some people do run on diesel. Some people run on high test. That's my job as a chiropractic doctor, to get you to start thinking about your food, thinking about your body, and what it runs best on. We're going to start with general concepts about eating in a healthy manner. And let's face it, guys, everybody knows what a healthy diet is. It's fruits, it's vegetables, it's no coffee or minimal, it's no white sugar, it's no white flour, it's no fried foods. We all know that. So anyway, that's why I'm so passionate about diet and nutrition. But I'm not going to tell you to take a bunch of supplements if you aren't eating right. That's like a person who has, oh, let's just say diabetes, saying, well, I'm going to eat the donut and then just take more insulin. Sure, you can do that, but what's a better choice? Don't eat the donut. So I want you to start thinking about foods, and it all starts with what Hippocrates said so many years ago: let medicine be thy food and let food be thy medicine. And that's where fabulous feasts come from. Now, we talked about diet's one of the 5 factors of health. What are the other factors? Well, rest is important. You got to make sure you got enough rest, because if you don't rest, you don't heal, you don't recover. So that's important. And we have a whole section about sleep hygiene in the office and supplements and lifestyle and what to do about that. And beyond that is exercise. You got to exercise. Some people need flexibility. Everybody needs cardio, the #1 killer in America. Some people need strength training. Did you know that men who strength train, who do resistance training, live longer? Yeah, they live longer. So little things like that is what we bring to the table. But what do you need? Well, that's our job, is to balance all of that. Cardio, flexibility, and strength training. Beyond that, we have a healthy mental attitude and, of course, chiropractic adjustments. Because the chiropractic adjustment balances the nervous system, which is the governing system for the rest of the body. That's this topic of a whole nother video, and we'll get there. But chiropractic is about diet, rest, exercise, a healthy mental attitude, and keeping your spine freely movable, because you're as young as your spine is flexible. So the veal's got nice color to it. We flipped it over. I'm going to transfer it to another plate. And I really just flipped the veal once. All right. We're going to deglaze the pan with a little bit of red wine. Just takes a moment, get those goodies off the bottom. Now, a lot of times after I pound my veal, I'll add a little salt and pepper right then. But today, since I didn't salt it ahead of time because of the show, I'm going to add some salt and the pepper as we make the sauce. So that's going to cook down, the alcohol comes off. Don't add a lot of tomatoes. It's not a pasta sauce, all right? It's a sauce for the veal, all right? And we're also going to get some fluid off of the peas. So get the tomatoes in there. San Marzano tomato. San Marzano tomatoes are going to be a little bit sweeter. if you're gonna, cook, cook with the tomatoes that really give you that sweetness. If you're gonna be using other tomatoes that may have some tartness, you may need to add a little bit of onion or a little bit of carrot to give you some sweetness in the dish. So we were talking before about inflammation. Everybody thinks inflammation is bad, right? Inflammation is bad for you. Let's add some salt. Well, guess what? If you sprain your ankle and it swells up, that swelling is actually good. We want that swelling because that prevents the other tissues in the area from getting irritated, all right? It localizes the injury to one spot so the chemicals that got released don't spread throughout the body. So that's acute swelling. And acute swelling lasts 3 to 5 days. If it lasts more than that, now you're getting into chronic swelling. That's a problem, or chronic inflammation. Hey, we just got over this COVID pandemic, and everybody talks about chronic low-grade inflammation, the cytokine storm. Yeah, that's what we're talking about. We want to suppress that cytokine storm. So there we go. The tomatoes are cooking really well. And how do you do that? Lots of green vegetations, omega-3 fatty acids in your diet, lots of vegetables in your diet. So we're going to put the meat back in. We're going to add peas, the low salt ones with the juice, and we're going to cover it. And as my pop used to say, my father used to say, now you got to let it marry. Now you got to let the flavors come together. We're going to let that simmer and cook, oh gosh, for about 5 minutes or so. But while we're doing that, we can plate our salad, all right? Because this is going to get paired with a salad. Why? Because it's vegetation. And your salads need to have at least 3 colors in them. What do vegetation do? What does vegetables do? It drives an anti-inflammatory lifestyle. You can have a little bit of meat. You can have a little bit of grains, but the bottom line is 70% of your diet has to be anti-inflammatory. So I'm going to go with arugula, baby arugula, and we're going to add some endive to it. And then we're going to add some golden beets. So you can take a golden beet, peel it, and then just use your potato peeler and put it right in there. And that gives me my 3 colors. Now this is really cooking hard. I'm going to bring it down a little bit because I don't want it to dry out. If it gets a little dry, I think my fire just went out. If it gets a little dry, just add a little water to it. So you can just shred some beets over it, and there you go. You have 3 colors in your salad. Why 3 colors? Because that gives you all the different anti-inflammatory properties of the colored fruits and vegetables, the xanthins, your carotenoids, greens and vegetation are where all of those goodies are. So let's dress it with some olive oil. Extra virgin olive oil would be ideal, but guess what? It's in the cabinet today, so I'm using regular olive oil. Always put your olive oil on first because you want to protect the salad from the wilting of the vinegar. We'll do a small balsamic vinegar. This definitely gets a little pinch of salt. Definitely gets fresh ground pepper. And it gets a little bit of goat cheese. Why goat cheese? Because it's easier to digest than cow's milk, and it gives it a nice little sting. It's got a little bit of a nice touch to it. All right. So that's going to be our salad. Here. And let's take a look at our peas, and looking good. See, we want that little bit of sauce in there. It's just about done. How do I know it's done? because when you take the lid off, it goes, ooh, that's when you know it's done. No, you can tell it's done because the sauce starts to stick to the veal a little bit. All right, that's how you know. And it's got a little body to it. Now, I do need to check on our squash. Ah, perfect. Oh, baby, that's nice. I'm going to switch hands. Let's plate this up. So we're going to put some of our delicata squash on the plate. And again, you can eat the rind and everything. Let's put that, it's hot. Ooh, baby. So that makes it a nice touch. Let's take a look at our, there we go. It's thickening a little nicely. See, the tomatoes are starting to stick now to the veal. It's got some body. It's married, all right? So remember, your diet can drive inflammation in your body. If you get hurt, if you have an acute injury, inflammation is good. But chronic, everyday inflammation will make you susceptible for disease. Any itis, cirrhosis, gastritis, neuritis, arthrosclerosis, they're all itises, they're all osises, they're all inflammation. So you have lower systemic inflammation, you're going to be healthier. Your genetic expression for disease is going to be less. That's why it's really important to eat lots of vegetables. Look at this meal. We have squash. We have peas. We have some nice milk-fed, free-roaming veal. Then, yeah, this is one serving of salad, guys. This isn't the serving for the whole family. This is one serving. If you're not eating this much salad a day, you're not eating enough. And then we got arugula, we got endive, and we have beets. So lots of color, lots of flavor, and boy, if you want to have some meals that'll knock your socks off, just start using some different foods and have some fun. And the delicata squash, eat the skin and everything. It's good for you. So, peas with veal, paired it up with a little delicata squash, goat cheese, endive salad with arugula, and I think you'll have a nice meal. Veal's nice and delicate. Needs a touch more salt. Remember I said I didn't salt it before I put it in the pan, so it needs just a touch of salt. So make sure you just add a little bit of salt and pepper for flavor, but you know, that's to your taste. Well, thanks for tuning in. It's been a great show. I want to thank my sponsor for this show, Finalizing. Finalizing is a transdermal topical for pain control and helps suppress pain. It's a transdermal, which means it absorbs through the skin. And by absorbing through the skin, the active ingredient gets to the pain-sensing nerves and receptors within the skin. And the great thing about it, it penetrates through the skin, but it doesn't get into your bloodstream. So it's called a local transdermal topical. It's the only topical I'm aware of that has a local transdermal absorption and release over time. So it gets in the tissues and it slowly releases over time. The active ingredient happens to be a CBD2 isolate. That's how it works, but it goes right to those pain-sensing nerves and receptors within the skin. Great stuff. We use it all the time in the office. So thanks, Finalizing. I appreciate your support. Check it out. Got disc? Got a herniated disc? Got a slip disc? One of these things where the disc slips out and it pinches on the nerve right here. That's a herniated disc. That's what it looks like from the top, where it bulges out. I'm Dr. Donald DeFabio, and we treat these conditions all the time. Sometimes we do manual therapy, special type of adjustment, but most of the time we use decompression traction, which does this. Separates the vertebrae a little bit, creates a negative pressure around the disc so that it sucks it back in. Research has shown on an MRI you only have to have a difference of this disc between 1 to 2 millimeters to go from excruciating leg pain to no symptoms at all. So that's why it just has to make a subtle change to get the pressure off the nerve. Now, what is decompression traction? Well, this is decompression traction, where we take a harness and we have a harness attached to the ribs. We have another harness attached to the legs. This is tightened up. Now, this part of the table pulls away from that part of the table, creating traction. You can hold on to the careware in the lumbar spine. So it's creating, you're lying down in this position, this, where it's stretching out, where it's stretching out, where it's stretching out. We start out with a few minutes with a light amount of weight, and then we build up from there. So that's the spinal decompression traction. And that's going to take the pressure off, but we need the tissues to heal, and we got to get rid of the inflammation. That's what we use the careware patch for. After this, we'll place this right on the lower back. It's an LED light therapy, which we leave on for a half hour. That stimulates nitric oxide release from the area. It helps reduce free radicals. It helps stimulate sensors that decrease inflammation and pain. LED low-level laser, photobiomodulation is the big name for it. So this will also work in conjunction with the traction and oftentimes traditional electrical muscle stimulation. All of those things tie in with their adjustments, tie in with your home exercises, and that's how you fix a slipped disc and get rid of that sciatica. So how long does it take? If you're getting leg pain, it takes 3 weeks of treatment, and you should see a 50% improvement, not only how you feel, but in how much that leg can move. If we see that kind of response, then we continue to progress. If we don't see that kind of response, then we have to look at what else we might have to do to get you and your life back. So, got disc? All right, if you do, you need us so you can stretch it out with some spinal decompression and multimodal chiropractic care to get your life back. I'm Dr. Donald DeFabio. It's been a great day to talk rehab and disc injuries. It's Fabulous Feast. Thanks for tuning in. And I'm Dr. Donald DeFabio, and welcome to my office. We're filming live today. We're going to do 3 episodes of Fabulous Feast. What's Fabulous Feast all about? Fabulous Feast is all about empowering you to make better food choices. Foods that are going to help decrease inflammation, foods that are going to help you feel better and even get better if you're not feeling well. Because like Hippocrates said, let medicine be thy food and let food be thy medicine. Well, that's what Fabulous Feast is all about today, and we're on location at my office, so enjoy. We'll be doing 2 other posts that are going to be different today as well. So we'll be going live again at 3 o'clock p.m. Eastern Standard Time and live again at 5 o'clock. So we've got 3 different episodes today, a lot of information. I want to welcome my live audience. Thanks for coming out today. Anyway, people are coming in and out of the office. Let's talk about something that's going to be cleansing and something that's going to be light and something that's going to be nutrient dense, because yesterday was Thanksgiving. So we want to get things kind of balanced. So we're going to start with a green smoothie. And we want to use ingredients that are going to help with flushing out toxins. It's going to get your GI system balanced because you might have been eating a lot of things that you normally don't eat. So we're going to take a NutriBullet or your blender of choice. You can even use your own blender. I'm going to start with parsley. A whole Italian parsley with a little bit of ice. Then we're going to add celery. You can even buy celery juice on its own in the stores today. And celery is what's called alkalizing. So it helps keep your pH in your body balanced so that your body doesn't have to absorb nutrients from your bones to help maintain pH. Celery is really good. So we're also going to add some of the leaves of the celery. Gives it a little bit of a bitter flavor. So if you don't like that, you don't have to use it, but it's going to give you a little more nutrients. So greens are nutrient dense. This other one we're going to add is cilantro. Now, both parsley and cilantro give nice flavor, but they also leach heavy metals out of the body. So we're exposed to lead, we're exposed to mercury, we're exposed to cadmium. Adding adding parsley and cilantro help pull out those heavy metals. We need a little bit of sweetness. For this, I'm going to add, something. I'm going to add a banana. All right. I just feel like having some banana in there. I think it'll be a nice flavor to go with it. Can you add carrot? Yes. Can you add beet? Yes. But I really want to emphasize the green. So we'll add a little banana. And then to ramp up the antioxidant qualities, the cleansing qualities, and to give me a little bit of protein, I'm going to add some ground hemp. You can see it's extremely green because we want the protein. We want those omega-3 fatty acids to decrease inflammation, and we want to push the greens. Fluid, you can use water. You can use almond milk. I'm using plain old coconut milk. And coconut water. I like coconut water because it is high in potassium. We all could use a little extra potassium. And so I like that, and I like the flavor. Then we're going to add a piece of ginger, also very anti-inflammatory. Fresh ginger, about the size of the tip of my thumb. How does that look? It looks like it needs a little bit more water. So we're going to add a little bit more of the coconut water. And again, is it exact? No, this is all about what you like. But we want to push the greens. They're cleansing, they're anti-inflammatory, they're alkalizing. And if you're someone that's looking to get your body back on track, you can make one of these green smoothies. I don't think that's the right lid. Let's try this lid. You can make one of these green smoothies. That's the right lid. Now, if I can find the right blender, I'll be in good shape. Let's try this one. Nope. When in doubt, go to the next blender. Now I added a little bit of ice just to make it fresh, but you don't need the ice. But if you make one of these smoothies full of the fiber, drink this down before meals. And by drinking this down before meals, what'll happen is it'll give you good nutrients, it'll fill you up a little bit, and then you won't start reaching for all of the junk, especially if you're going out to a holiday meal. Power packed green smoothie. Can't go wrong with some extra hemp protein. What do you want? Something a little sweeter? Well, let's go with some pineapple. This time we're going to go sweet, but we're going to go with a protein punch. So we'll take some pineapple. We're going to make a pseudo colada, pina colada. On top of that, we're going to add 30 grams of vanilla protein powder right in there. For a little texture, I'm going to add some nice ripe pear. Doesn't give a lot of flavor, but it gives real nice texture. So I'm just going to add a half a pear, core out the inside. And then, once again, this is my go-to, is the coconut water. All right? Now let's see if this is the right lid. Ninja, baby. Okay. So that goes in here. Goes on this guy. Oh, I got to go around to the front. That's all. So this is going to be a protein pack. So if you want a quick on-the-go protein meal, this is a great choice. And the pineapple and the pear go really, really well together. This one, I wanted it thicker. I didn't add any ice, so it's going to come out a little bit more on the thick side. And then, look out, it's like a milkshake. This is good. I like this one a lot. Greens are for cleansing. This is nutrient dense. Now, I'm going to pour one because Dr. Slade said he needed some protein, so this is going to be for Dr. Slade right here. I'm going to put that aside for him, all right? By the way, I want to give a quick shout out to Joan Rotundi, who hopefully is watching. She got me started doing TV production. 1999 was my first show, so thanks, Joan. I appreciate it. Hey, let's do one that's got antioxidant qualities next. How about a blueberry? So I have a little ice in this. Last Ninja. We got some blueberries. Now, these blueberries, it's what? What time of year? It's November. These blueberries are frozen. Now, why did I pick frozen blueberries? Because I could have bought fresh blueberries. They have them at the store, but they came from Ecuador. I have no idea how they harvest their fruit in Ecuador, what kind of preservatives they do or don't use, what kind of pesticides they do or don't use. So rather than do that, I bought frozen organic blueberries. I know they're grown organically, they're frozen, so the nutrients are there. So I think that's a much better choice. You not only have to look at your food, you have to look at where it's from. Blueberries are super anti-inflammatory. Oh, Dr. Slade. Dr. Slade, here's your protein shake.
Oh, thanks, Doc.
All right, you're welcome. I know you wanted a protein shake. On the go. On the go. He's working. So we have some blueberries in here. This one I'm going to add some carrot. Now, organic carrot. So guess what? I didn't take the skin off. I washed it, but I didn't take the skin off because it's organic. For this, we're going to need a little bit of sweetness. We could go with banana, or we could go with pear, or since I have them both here, I could do them both even. So it can go either way. But you need a little bit of sweetness. I'm going to go with this, core out the other half of this pear. And then I'm going to put a little protein boost in there as well. Can I add greens to this? Does it have to just be an antioxidant with blueberries? No, I can do whatever I want. So how about, I'm going to go with cilantro. I want a little sting of the cilantro, a little bit of bite. But again, we're exposed to toxins all the time. Anything we can do to get those heavy metals out of our system is a good choice. So I'm going to put that in through there as well. And you know something? How about some plain old romaine lettuce? Now, the romaine lettuce would have gone great with the greens drink as well. And mix it up. Have a little coconut milk here to give it a little bit more body. We can use that. But the blueberries, really high in antioxidants, are very, very important. Berries are the only food that's been related specifically through research to improve brain health. So if you want to improve your brain health, eat your berries. Your mother was right. Let's see, let's find the one. That's the one. Give it a little shake. There we go. Blueberry smoothie. High in antioxidants, great for brain health. So you can make, and I added a little greens to it for some detoxification. So endless possibilities you can do with these. Now this one's really thick. So we're going to add a little more coconut milk just to loosen it a little bit. Just a little bit. It's just a little too thick. Ah, now it's slushy. So we got a nice slushy. Now, if you notice on the corner of the table, we have one other thing that is also very good for our morning. These are all really good, quick, on-the-go morning things. This would also go well with a protein powder. Yeah. I put some now you can really taste the cilantro in there. So I'm going to add some protein powder. I'm going to put in the rest of the blueberries because it needs a little bit more blueberry in it. And then there's more flavor in the coconut water than the coconut milk. So let's top this one off. And that'll give it a little bit more body. So these are all really good choices. This is just for cleansing. This has got some extra protein, and this has some extra protein. This is about 30 grams of protein each. The hemp protein isn't nearly as much. It's about 5. Bingo. So these are great ways to get a quick on-the-go meal for breakfast. People like this. But what we also use a lot of times for breakfast, or you can use, is a coconut. That's perfect. Is a coconut custard, egg custard. Perfect. Money. The vanilla protein on that is huge. It's great. So what we have over here is 6 egg yolks with a can of whole fat, whole coconut milk. So it's full of coconut fat, it's full of egg yolks, and they're omega-3 eggs. So that means they're very high in omega-3 fatty acids, and they're anti-inflammatory. So, and just sweetened with a little bit of maple syrup. This is a great savory dish. So you can have a couple of scoops of this in the morning. That'll set your blood sugar so you won't have a spike in blood sugar. And then you can also put some fresh fruit on it if you want. But that's a great recipe. And then with your leftover egg whites, you can always make an egg white omelet. So those are some really good smoothie choices to get your day started for detoxification, for power, for energy, and for cleansing. And if you just need something to set your blood sugar in the morning, the custard works really well. The coconut egg custard works really well. And that's a pretty good place to start. Any questions from our live audience? No, I appreciate, yeah.
For the coconut custard, would you just have a scoop of that every morning? So
Yeah.
To get you started?
So why don't you grab, let's see, there's some bowls on the bottom there, Vanessa, on the bottom. Right, the blue. Grab me a bowl and a spoon. I don't have a spoon. Yeah, I would just take a couple of scoops of that in the morning. So there's 6 egg yolks in there. So maybe, there's 5 to 6 or
that would be your breakfast.
Depends. If you're a keto person, this is a true ketogenic. Great, thank you very much. This is a true keto meal, okay? Because it's egg yolks and coconut fat. That's it. Pan's not on. So I would do just, this makes 5 servings, 5 4-ounce servings. So there you go.
And it's non-dairy, correct?
Coconut.
Perfect.
All right. And so it's very, so if you're on a real true paleo keto person that wants those good fats, yeah, you could just have that for breakfast alone. Okay? That could set you.
A couple of days ahead of time.
This will stay well. Now, the caveat with this is you have coconut oil in here. So when you put it in the fridge, it's going to be a little firmer texture. Okay? So I had this sitting out, so it's going to give that soft custard texture because coconut oil is a little bit firmer. All right? So, questions, should we make an omelet or we're good?
It's up to you.
I don't know. You girls want to do a egg white omelet with our egg whites that are left over?
I think so.
We can do it. All right. We're going to go on to an egg white omelet because we got 6 egg whites left over. So a little bit of olive oil. Where are my egg whites? Oh, there they are. Let's make a spin. Let's keep it in the vein. Let's add some spinach. Okay. So we'll saute up a little bit of spinach. Make it simple. We'll saute up a little bit. This pan's going to be a little big, but it'll work. saute up a little spinach, and then we'll add the egg whites. We'll fold it over and make it 1, 2, 3. And then if we wanted to add any fresh parsley on top as a garnish, we could do that. So some fresh spinach. You know, yesterday we had asparagus for dinner. Leftover asparagus in here would be fine. Don't have to cook it that much, okay? That would be a nice thing you can also do to use up your leftovers. You can also put leftover turkey in there as well. Would also work just fine. So there's lots of ways you can repurpose foods. In fact, everybody can remember, next show it's going to be like a chopped. Bring in your leftovers and we'll figure out what we can make out of them, you know? You never know. You know, spinach, another green. Greens are so important for you. Our diets need to be 5 to 7 servings of vegetables a day. 5 to 7. How much do most of us get? Like a little bit of a sprinkle of lettuce on a sandwich, right? So we get very, very little. So we're going to let that saute up. I'm just going to whisk up. These are the egg whites, the same egg whites from the custard, all right? So just whisk that up a little bit. And here's my salt. Put a little salt in there. But yeah, you can make a frittata if you have any leftover vegetables. Ooh, sounds good. And the spinach cooks down to next to nothing. Good. And then you can also add any other spices, but what works really well is just swirl that around a little bit. This is where everybody in the audience is supposed to go, ooh.
Is most of the nutrition in the yellow part?
Good question. The yolk is 50% fat and 50% protein. So the nutrients of an egg, the omega-3 fatty acids, the selenium, the trace minerals, are going to be found in the yolk. The egg whites is just protein. This is just protein, okay? So there's nothing in here besides protein. So that's a really good question. And when you're getting eggs, you want to get a free-range egg or an omega-3 egg that are high in those omega-3 fatty acids, all right? Omega-3 fatty acids decrease inflammation. Inflammation drives disease. So by decreasing inflammation, you'll be less prone for whatever your genetic expression for disease is. So that's why it's really important. And simple. We happen to have some spinach, so we made a spinach egg white. Omelet. Might stick a little bit on the sides, but hey, what's an omelet if it doesn't stick a little? Yeah, it just takes you a few minutes. That way you're multi-purposing all your foods. You're not leaving any foods left not to be used. But again, protein's going to set your blood sugar. And by setting your blood sugar throughout the day, then you get less energy drops. One of the major reasons people get energy drops is because their blood sugar crashes. So if you eat protein, you eat a good quality fat in the morning, all right? What are good quality fats? Olive oil, coconut oil, almond oil, things like that. Those are all good quality fats. Am I going to get lucky? I think I'm going to get lucky and get this flipped? I don't know. Let's see. Yeah, we got lucky. Nut butters, macadamia nut oil, walnut oil. Those are really good. What are bad oils? Corn oil, safflower seed oil, cottonseed oil, canola oil. They all drive inflammation. So you want to stay away from those oils. And there we go. Let's see. Rebecca, could you please grab me a plate down on the bottom? There should be on to the right there. Thank you very much. And just for that, you're going to get a chance to have some of our real simple egg white spinach omelet. So thanks for tuning into episode 1 of our series on healthy eating for the holidays. We did power green smoothie, protein smoothie, antioxidant brain power smoothie, and some high protein, nutrient dense foods here. And also we topped it off with a little bit of coconut custard. Thanks for tuning in. I'm Dr. Donald DeFabi. We'll see you at 3 o'clock for episode 2. That's all about sweet treats. Gut health, probiotics. People take them all the time. Good bacteria to improve your gut health. Why do you do that? Because the neurotransmitters that affect your brain are 80% are synthesized in your gut. Gut health is related to sleep quality. Gut health is related to your immunity, your ability to fight off infections. The microbiome is related to so many functions in the body. However, how do you balance it? Well, you take a probiotic. The problem is different companies have different probiotic strains in them. So I recommend you rotate through different companies and different probiotic strains. One of the ones I rotate in is Probiomed 50 by Designs for Health. It's got 8 different microorganisms in there, and their concentration is 50 million CFUs. Heat stable, so you don't have to keep it refrigerated. Another product to rotate in as you take your probiotics to make sure you get all the different strains. That's your tip for today. It's a great day to talk recurrent shoulder pain and why. And that's what we're going to talk about today. Every day we hear it in the office. How come my shoulder keeps bothering me? How come when I bench it's a problem? How come every time I play more than one set of tennis my shoulder starts to bother me? Why does it keep coming back? And it's really pretty simple. It's because the glenohumeral joint is jammed up. What does that mean? The arm bone is here, and then you have the socket in through here, then you have the collarbone up along the top in through here. The arm bone and the socket, if it drifts up, the rotator cuff gets pinched underneath the collarbone, the AC joint it's called. So anything that's going to allow that shoulder bone, the humerus, the ball, right up in the socket is going to give you pain. So what we need to do is keep the shoulder depressed in the socket and prevent it from this, because this also pinches the rotator cuff underneath the collarbone, the AC joint. So we need to keep you back and down. How do we do that? Number 1, make sure your subscapularis muscle, your largest rotator cuff muscle, which runs on the inside of your wing bone and causes internal rotation and centration of the joint, meaning it keeps it in good alignment, is strong and compliant. Doesn't just need strength. Muscles are elastic. They're like a rubber band. If you make it really strong, like a piece of leather, it's really strong, but it doesn't have elasticity, bad news. Because when you go to use it, it's just going to twang and pull. And if your subscapularis twangs and pulls, it's going to cause the arm bone, the humerus, to ride up in the socket, pinching the rotator cuff, your supraspinatus nerve. So that's the first thing we have to check for, is whether you have compliance in your subscapularis. It needs to be loose and strong, both. The second thing we need to do is to make sure the external rotators, the muscles that turn you out, are at least twice as strong, all right, as the muscles that pull you in. So they need to be really strong. However, the scapular retractors and depressors, the muscles that lift your chest up, also need to be strong so that the shoulder's down. So what do I mean? Retract your there you go. So he retracted, but these muscles got all jacked up. That's bad news, okay? we need to retract and depress. And these are all soft. That's what we want. We want these muscles to stay unengaged as you retract and set or centrate or spiral. Those are all the same synonyms for setting the humerus, the arm bone, in the socket and keeping the scapula, the wing bone, on the rib cage. So stand up for me now. Face that way, please. We want to set the scapula on the back, on the rib cage, and at the same time keep the humerus, the arm bone, set in the socket. Now, this posture needs to be maintained with activity, with reaching overhead, okay? With rowing motions, with lateral raise motions. And you're not going to get recurrent shoulder pain. It is that simple. If you're here and you flex, it's going to give you pain. If you're there and you flex, it's going to give you pain. It is that simple. So you got to spiral, centrate, put everything into neutral alignment. Then from there, you load it with sport, with activity, with whatever you need to do. That's the major reason you get recurrent shoulder pain, and that's the way you need to fix it. Make sure you have compliance and strength to all the muscles that stabilize and maintain proper alignment of the shoulder girdle, which is the glenohumeral joint, the ball and socket, the AC joint, where the collarbone and the wing bone meet, the wing bone on the rib cage, and of course, the collarbone where it meets the breastbone. A lot of information, simple, but may not be easy to do. Any questions, let me know. Have a great day. Thanks for tuning in and subscribing. I really appreciate it. Welcome to Fabulous Feasts, Episode 3, Holiday Eating in a Healthy Way. I'm Dr. Donald DeFabio. Thanks for tuning in for this series of Fabulous Feasts. Today it's going to be about protein. But what is Fabulous Feasts all about? Fabulous Feasts is all about eating foods that are healthy for you, foods that will reduce inflammation in your body, because inflammation drives disease, and to help you think about pairing foods together that you may not already thought to do. Foods that are going to give you a different flavor palette that will help, again, to improve your health if you've lost it, to help maintain your health if you have it, and more importantly, to keep you in an anti-inflammatory state. Hippocrates is the one who said it, let food be thy medicine, let medicine be thy food. That's what Fabulous Feast is all about. First episode today was on smoothies for detoxification and cleansing, and for proteins stabilizing your blood sugar levels. The second show is about sweet treats and the importance of embracing the bitter, and we talked also about different types of sugar substitutes. But today it's protein. As you saw in the thumbnail, winner, winner, chicken dinner. We're going to take a twist on a taco using chicken, but we're not going to be using just these for the taco. We're going to show you how you can overload your body with those vegetables that'll give you that extra punch, because it's all about the vegetables. But we are going to have protein. It's dinner time. So we're going to warm up our skillet first. And in this skillet, we're going to add a little bit of olive oil for a couple of reasons. Number one, we're using breast meat chicken. And number two, it doesn't have fat, so we need a little bit of fat. Number three, we want to create that glaze. Using olive oil is a good oil. Can I use coconut oil? Yes, slightly different flavor, but it's a good oil to cook with as well. You can also use walnut oil or any other nut oil, another good oil. While that's heating up, my staff needs to remind me to remind you that this month, for the gift of health, we have 15% off all of our supplements, supports, and appliances. So call us for your holiday Give the Gift of Health sale. So as that's heating up a little bit, I'm going to take our chicken.
We have a question. What about avocado oil?
Avocado oil is great. In fact, we're going to be talking about avocados in this dish. It's a great fat. It's a good plant-based fat, and it's a good fat to include. Remember, the fats we want to avoid are your arachidonic acid fats that come from grains, that come from seed oils like corn oil, soybean oil, things like that. So the flavor palette for the chicken today is going to be Mexican. It's going to be a Mexican flavor. So what I did is I made a Mexican spice rub. All right, cumin, garlic powder, oregano, paprika, chili powder, a little bit of heat, a little bit of cayenne. Just sprinkle that, salt and pepper. Just sprinkle that over the top. So that's already pre-made. So it's going to give us that Mexican type of flavor. We're going to let that kind of heat up a little bit. Then we'll stir it around. If you keep moving the meat, it doesn't get a chance to really get that little bit of a sear and to seal in the juices. So let it get the juices sealed in a little bit. And then to get those spices around all of it, we're just going to deglaze the pan with a little bit of white wine. So that'll help give it a nice body, but at the same time, it'll get the spices all over. So that's starting to fire up nicely. So now we're just going to flip it over. Now, in our previous show, we talked about chicken. Not all chicken's the same. You need to get a chicken that is raised appropriately, meaning they're allowed to walk around, they get some activity, because if they're in closed pens all the time, the chickens don't get a chance to develop any mobility or strength in their legs. Broiler chickens are meant to mature in 6 to 8 weeks, and if they stand in the same place or if their legs get super weak, what happens is they end up standing in their own feces all day long. So you got to look at if the chickens are allowed to be free range, and you also have to look at how they're slaughtered. Ideally, the chicken should set. It should let the meat should hang for several hours. By letting it hang for several hours, it's just like having an aged beef. If you just let it age for a few hours, it won't be so tough. Now, most chicken isn't aged for a few hours. So these are chicken breasts. We sliced them in half. Then I sliced them again on the bias into small pieces, so they'll be more tender. If you're concerned about them being even more tender, that might still be tough, pound them. Just pound it, and that'll make it tender. And that's why so many dishes today call for pound flesh. So that's glazing, cooking down nicely. Plenty of spice rub in there. I'm going to let that run a little bit. Now, while that's cooking, we're going to talk about these babies. These we made after the last show, because I realized sometimes people want something that's in the vegetarian and vegan, wheat-free, dairy-free. So for those people, we have our coconut blueberry muffins. Coconut flour, coconut oil, eggs, and blueberries. So it's a great, good fat, a lot of fat in here, but we use omega-3 eggs and we use coconut oil. So this is a great snack, on-the-go type of grab-and-go thing. Healthy fats, healthy flour. So on the previous show, we did the same recipe with banana. There's chia seeds and banana. This one is blueberry and chia seeds. So that's a good way to put that together. Meat's almost ready. I'm going to just let it cook. But again, I want to get that spice rub over all the different pieces of meat, and I want to get it symmetrical. So I turned up the heat a little bit, and we're going to add just a touch of white wine. There we go. Now it would create a sauce if we let it, but we're going to let it deglaze. But now all of the meat will be evenly flavored. And these small pieces only take a few minutes. You know, in our house, this would qualify for Taco Tuesday in our house. We can get this on the table in 15 minutes. It really is a quick dish to prepare. So throughout the day, we've been talking about the importance of vegetables. And you need 5 to 7 servings of vegetables a day. We've been talking about staying away from grains, because grains have a tendency to be pro-inflammatory because of the arachidonic acid in the grains. And in the United States, wheat, for example, they spray the fields with Roundup so that the whole wheat field matures at the same time, and they can harvest the whole field. That's why people have so many gluten sensitivity issues. It's because of the glycophosphate that's in the wheat. And GMO wheat is designed to not die with glycophosphate. So they can spray Roundup on it all day long. And what does it do? It ends up in our stomach and it creates gluten sensitivity. You know, well, guess what? It may not be the gluten, it may be the glycophosphate. So to avoid that, you got to get an organically raised wheat, and preferably, if you can find it, non-GMO. Try to get your wheat from Europe. In Europe, they don't have GMOs and they aren't allowed to use glycophosphate. That's why when people go to Europe, they can eat the bread and they can eat the pasta and it doesn't bother their stomach because the food's fresh. It's not preserved. It's not surrounded with junk. So the meat's done. It's got a little bit of a glaze to it now, a little white wine reduction, and the Mexican seasonings with everything. So traditionally, we would take something like this and put it on a taco shell, right? Maybe some red cabbage. Why red cabbage? Red cabbage is really high in anthocyanidins, antioxidants. Get in as much red cabbage in your diet as you can. It really helps boost your immune system, these colored foods. Blueberries, red cabbage, carrots, things with lots of color are really good. On top of that, we're going to put a mango salsa on that. Now, this is for my psoriasis patients, is a mango salsa that is pepper-free. So it's got carrots, shallots, mango, and that white is hemp hearts. Why did I put hemp hearts in there? Because hemp hearts are high in omega-3 fatty acids. Omega-3 fatty acids are anti-inflammatory, a great source of nutrients, a good fat that reduces inflammation. You want to go for the full boat ride? You can put a little bit of avocado in there as well. Again, the question we got just a moment ago online, avocado's a good fat. And then if you really want to go with the full tilt Mexican approach, we'll give you a little wedge of lime for it. But guess what? There's still a corn tortilla out there. So there is some corn, but it's not fried. It's not one of those fried tortillas, all right? So it's not as bad as the fried ones. It's just a pounded tortilla. So you can use a small tortilla. But let's say you really want to embrace an anti-inflammatory lifestyle. Well, what about taking something as simple as endive? A couple of endive leaves. You can do the same thing. Put your chicken in there. Now, this is great if you're making little dessert or little pickups for an appetizer. Mango. Put with it whatever you want. Some avocado. If you don't like avocado, don't use the avocado. But here you go. You have your tacos, so to speak, with an avocado shell. I just told you how good and how important red cabbage is for you. If you cut the top off the red cabbage, it gives you these great little circles. So you got a taco shell. What are we going to fill it with? Today we're using meat. Could this be a vegetarian? Could this be a portobello mushroom sliced up and cooked the same way with the same seasoning to have a vegetarian Mexican dish? Yes. But I'm getting my vegetables in here. So I'm going to go with avocado with this one and mango salsa with this one. Are these the only dressings? No, you can use whatever you want. But what I want you to realize is that we're going to save these for later, Mom. I'm not going to have my muffins for before. I'm going to have them later. But maybe you don't like red cabbage. Well, what about Bib lettuce? You do the same thing with Bib lettuce. I think you get the picture. All right. Now, can these also be made ahead of time? They sure can. You can meal prep this and make it ahead of time, and then you can keep it in a container and bring it to work with you and serve it room temperature. I'm not personally a big fan of microwaves, but if that doesn't bother you, then that's okay. And there you go. No avocado on this one. I think I'll just go with mango salsa. All right? And here's another option for you, Bib lettuce. But I don't like Bib lettuce. All right. You can use romaine lettuce. That's not a good leaf. Let's use this. There we go. And if you get romaine lettuce that's organic, you're going to notice it's a lot firmer. It just is a lot stiffer and a lot firmer. So we can put it right in through there, and we get our meat. So you can see how this taco Mexican chicken can go in so many different layers. You can still eat it with your hands, or you can just make a simple salad out of it as well, which is going to be our last thing we're going to do. And there we go.
Put that. Got another question coming in. Someone was asking about the red cabbage. When you cook it, does it lose any of its nutritional values?
Yes, it does. Is it still good for you? It is good for you, but some of those antioxidants do break down. So get some good knife skills and cut it really thinly. However, remember, what's coleslaw? Coleslaw is just pickled cabbage, right? So you can also pickle it, and then it becomes fermented, almost like a sauerkraut. That's really good for you because now you have the probiotics. So you may lose some, if you cook it, you may lose some of the antioxidants, but you can pick it up on the other end if it's fermented. But you know something? If you need to eat your borscht because you want to have it cooked and you're not going to eat it raw, that's okay. Your mother was right. Eat your vegetables, all right? That's what's most important. 5 to 7 serving of vegetables a day. And if you really want to go over the top, guess what? You take your endive, get a few pieces of endive. I love endive. Sometimes I'll just eat endive and avocado. Just endive and avocado. I'll go over to the store at lunchtime. If I can find a ripe avocado, I'll eat a whole avocado and like 2 endives just like that. It is a great pairing. But let's take some endive. Just slice it up or break it up. You can do this ahead of time, or you can do it as needed. We'll take some Bibb lettuce. We'll take some romaine lettuce. We'll just kind of break it up, just hand tear it. And I think everybody can get an idea where we're going with this, right? Just a hand tear it. We're going to give it a little hand toss. Now, if anybody who remembers Anna Marie Alberghetti would say, gently tear the lettuce to create little pieces. And then you can pour your salad dressing on it. So you put that over the top. And then you take your chicken. And that little bit of condensed sauce from your deglazing, and then a pinch of that. If you really want to go on the Mexican vein, you can pull a little bit of cilantro out. Not that much, just a little bit. Chop up a little bit of cilantro on the top, and then you're good to go. So is this the only way you can have Mexican chicken? Well, I don't know. I gave you Mexican chicken with Bibb lettuce, or with romaine lettuce, or with endive, or with a classic corn tortilla that's not fried, okay, not a fried tortilla. Or what about on a red cabbage leaf? That would be good too. Or maybe just Mexican chicken on a bed of greens with some red cabbage. Gets the extra color in there. That's really, really important. So what have we learned today? You know something? I love avocado. This is a good fat. So we're going to even put a piece of avocado in there too. Why not? Why not? If they can add avocado on your lunch and on your sandwich at the restaurant, we can do it at home too. So a nice little treat for you. Remember to add all the different colored foods into your diet. Add more vegetables. When you have your protein, serving size about the size of your fist, and just add different flavors, and you'll be amazed at how much better you feel. Stay away from the white sugar. Stay away from the white flour. And remember, you are what not only you eat, but what your food eats. So read your labels. Look at your ingredients. Where's your food sourced from? Those are all really important things to consider when you want to get to a dietary lifestyle that's going to improve or sustain your health. Because there's a lot of pesticides out there, there's a lot of preservatives out there. Just staying away from those types of things alone can make a huge impact in your health. But what will definitely impact your health is eating lots of vegetables, lots of fruits, lean protein. We know that. An anti-inflammatory diet will reduce your genetic expression for disease. And that's what this series has been about. It's about eating foods that are tasty, foods that you can enjoy. They might be a little different for you, they may not be. But it's all a way that you can empower yourself to make choices that are consistent with healthy aging, and if you're an athlete, with excellent sports performance. Because if you don't fuel the body, how are you going to perform? And not all carbs are created equal when it comes to athletics. But that's the topic of another show, so stay tuned for that. I'm Dr. Donald DeFabio. Thank you for tuning into our series today on healthy eating for the holidays. It's been a lot of fun. Thanks for coming to my office, going on location. It's been a real treat. I want to give my live audience, give yourselves a round of applause, everybody. All right, we appreciate everybody coming out, especially a Friday night on Black Friday. And yeah, we're always a phone call away. Remember to like and subscribe. And I hope you enjoyed the series. Have a great day. It's a great day to talk sleeping positions. That's right, sleeping positions. Why? Because if you don't sleep and get quality sleep, your body doesn't heal. It doesn't recover. It doesn't rejuvenate. And all the exercises, all the nutraceuticals, all of your adjustments aren't going to work as effectively as they can for you. So getting good sleep quality is important, which means sleep posture. So what are our choices? Well, for most of us, there's 3 choices: on your back, on your stomach, and on your side. So we're just going to talk about that. Next week, Uncle Fester's going to be here, and we're going to talk about sleeping from your feet. So, but that'll be next week. Actually, that'll be Grandpa's going to come. Now, what we're going to do, if you're on your back, first thing we want to think about, actually, we always want to think about, regardless of the position, is neutral spine. We want to keep good alignment. As chiropractic doctors, that's what we treat. We treat alignment. Dynamic alignment, being able to have good, tall, strong posture in life, in sports, in recreation, whatever you want to do. So we're all about alignment to begin with, but that's what you have to be about when it comes to sleeping. So back sleeping, we want to make sure that your head's not jammed up too forward when it comes to the neck. That's too much of what we call flexion. Conversely, we don't want the head all the way back like that. That's too much extension. We want it in neutral, where it's straight. Now, does that mean you might need a little support for the neck? Yes. So if you lift your head up, maybe a small pillow, put your head down. Now that one's a little big. You see how it's lifted up? It would need to be a smaller pillow. But if you do need a small pillow for the neck, that's fine. However, that pillow doesn't go here. If it goes here, look what happens. The pillow has to support the neck, the shoulders, and the upper back. So shimmy a normal sized pillow down so that you're supported from the shoulders all the way up, and that'll keep you in what's called neutral spine, which is where we want to be. Arms at your sides is the best. If you want to be in zero gravity position, you slightly flex, elevate the arms, but nobody does that sleeping. Meditating, you can do that. Then when you get down to your legs, make sure you're nice and straight. And again, a small pillow under the knees, and let your legs go down, slightly flexes the knees, offloads the back. So on your back, it's all about neutral spine, keeping the body straight, making sure nothing's twisted, making sure nothing's stretched too much over the arms, over the head. It's going to stretch the arm and irritate the shoulder. So arms at the side, feet straight, small pillow under the knees. Side posture is another very good position. So roll over onto this side. So if you go on your side, it's the same concept. We want to keep good alignment. So the head and neck, here you can see it's too low. It's not straight. I don't care if it takes one pillow to keep it straight. I don't care if it takes 2 pillows and a cat. I don't care if it takes 16 pillows. We don't want you up here where you're kinked up. We want it nice and level right there. So very, very important. Arms just gently relaxed at your sides. I recommend you stack your shoulders. If you find that you're square here and this bothers the shoulder on the bottom, call us. It's a sign you might have rotator cuff tendinopathy or an irritation to your rotator cuff, something we can treat. As we come through here, this arm can just be kind of at your side. You want to keep the spine straight, hips are stacked, very important. You don't want the hips to roll forward. Conversely, you don't want the shoulders to roll back. You don't want to twist the spine. So keep that spine straight, all right? Again, hand up over here, not a good choice. Keep those arms down at your sides. Slight bend at the hip, slight bend at the knee. If you have hip problems or pain in the top hip, put a pillow in between the knees to keep that leg straight in alignment. If you're getting pain on that bottom hip, once again, give us a call. That's a sign there may be inflammation around the muscles of the hip. So stay stacked. Don't let your body twist forward. Don't let your body twist backward. Keep the spine in neutral position when you're on your side. Now, on your tummy, we're going to talk about it, but we do not recommend stomach sleeping. And here's why. Flip over onto your stomach. The first reason is that it creates an excessive arch through the lower back. So it's a major cause of lower back pain. Yes, some people find sleeping on their stomach is the only position they're comfortable. I get it. But for your spine, it causes it to jam up down here, so we generally do not recommend it. Also, you got to put those arms somewhere. So most people put them up like that over their head. We don't want your arms over your head, whether you're on your back, whether you're on your side, or whether you're on your stomach. It aggravates the shoulder, it aggravates what we call the thoracic outlet. It's a problem. So arms got to be at your side. But most people don't have a chiropractic table to sleep on, so what happens is their head gets rotated. And just like you're going to be rotated. You don't spend all day like this on the computer, right? You don't spend 8 hours with your head turned. Why would you spend 8 hours with your head turned sleeping? It doesn't make any sense. So if you're really committed to being on your stomach while you're sleeping, here are a couple of options to make it more of a effective position to get you more restful sleep and less of a cause of neck and back problems. Take a small pillow, put it under your tummy, and that'll flatten out the curve so it's not as arched. So that'll protect that. When it comes to the neck, put your head on the side of the pillow so your head's only turned 45 degrees as opposed to being on the top of the pillow where it's turned 90 degrees. Now it's only turned a little bit. If you really want to keep sleeping on your stomach and you really want that feel of being on your tummy and you want to save your neck and your back from a problem, get a body pillow. A body pillow, you can hug it and it'll feel like you're on your tummy, but guess what? You're on your side. So that's the best solution for the stomach sleeper. So let's get you off your tummy. Let's get you back on your back. Get you into a little bit of neutral spine. Get those knees bent a little bit. He's gonna fall asleep because I have a tendency to do that when I talk. You're gonna figure out what you need to do to get better sleep quality. And it starts with position. You need to wake up in the morning feeling rested and recovered so that you can start your day. If you're not feeling rested and recovered in the morning, well, you may have a sleep quality issue, and that's another reason you can call us, or guess what? Watch that video too. I'm Dr. Donald DeFabio. It's been a great day to put you to sleep. We'll check you on the next video. Thanks for tuning in. Victor, you got a little dysfunction in there. We took care of it. I think you're gonna be feeling much better, but you were just telling me something I want you to share with everybody else. What'd you say?
Well, what I was telling the Dr. DeFabio is that I've been coming here for like years, and every time I come, I get results. Positive results, quick results, and this doctor right here, if you guys have any issues, come to this guy. This guy will take care of you. We need one of these doctors in every state of the United States. Every doctor should be like Dr. DeFabio.
All right.
He's the best, in my opinion. Yeah.
Thank you,
very
Victor.
much. Thank
Appreciate
you.
it. Today I want to talk to you about all the different services we provide in the office, and which is a lot. But let's define each one of them specifically so everybody is clear on what we do and what you're receiving. The first and most important thing we do in the office is a spinal adjustment. And that's an adjustment, a chiropractic treatment of the spine. So doctor, show us a spinal adjustment means It's getting a treatment of the spine. Where's the spine start? At the neck, right? Right up and through here, and it goes down to where? To down and through there. So when we're working on that area of the spine, that's a spinal adjustment. And that means we're working on the vertebrae. We're working on creating a better alignment and motion of the vertebrae. It's just of the joints of the spine. By definition, a spinal manipulation is taking one vertebrae, causing it to move better on the vertebrae above and below. We use our hands, sometimes we'll use an adjusting instrument, sometimes the table will move, sometimes the table will clunk, but the bottom line is a spinal adjustment is just when we're treating from bottom tailbone to the first vertebrae, causing better alignment of the spine. The other time we adjust the bones is when we do an extraspinal. Now this is different. An extraspinal or non-spinal adjustment is ankles, feet, knees, shoulders, wrists, elbow, TMJ. Those are called extra or non-spinal adjustment. It's a different code, it's a different definition. And legally, they're actually two different services. And to get the body to move properly, the muscles have to work right. So we're big on muscle treatment. Now that's something different. That's a soft tissue treatment. So let's do some stretching of the iliopsoas muscle. So we do a lot of this contract, relax, where we stretch muscles. This is one technique that we use. This is a muscle treatment to cause lengthening of knots, to break down tightness and scar tissue, to cause better elasticity of the muscles, to break spasm. So we'll do it not just in the leg, we can do it maybe across the shoulder, some ischemic compression or some ART, where we push on the muscle and then cause it to stretch. It's called pin and stretch. Sometimes we'll use an instrument, a stainless steel instrument, to do a muscle adjustment. Most of the therapies we provide that are electrical, muscle stim, ultrasound, TechR, WinBack, those are muscle treatments. So, another form of muscle treatment, we're working the muscle and moving the leg. This is not an extraspinal joint treatment, it's actually a muscle treatment. So this is lots of different ways that we can get the job done. So on top of this menu of services that are done with our hands, we have all the machines that we use. We have ultrasound, we have laser, we have muscle stim, we have WinBack TechR, we have decompression traction. Those are all things that are modalities, those are therapies. Also, a different service. So, hopefully this makes it clear on what is a spinal adjustment, what is an extraspinal adjustment, they're separate and distinct, what is a soft tissue treatment, as well as the different therapies that are to help relax the muscles, improve range of motion, decrease pain, and increase function. On top of that, we even do exercises with you. So these are all different billing codes that we're required to use that you may see on your chart. So if you have any questions, you let us know. But that's a pretty good analysis of the different things we do in the office. Let's talk inflammation and supplements that'll help you manage inflammation. Essentially, inflammation falls into two categories. You have acute inflammation from an injury where you get swelling along with the inflammation, and then you have more chronic inflammation, and that's from eating poorly or micro trauma, small trauma over time. And we need to look at these things a little bit differently. Can you use both supplements together? Of course, but let's talk about them separately first. For acute trauma, I like Zymane by Zymogen Labs. Been using Zymane or versions of it for 35 years. They're called systemic enzymes or proteolytic enzymes. They're extracts of pineapple, bromelain, trypsin, and what they do is they reduce the amount of the protein exudate, the proteins that cause swelling. So you take them on an empty stomach, very important, And if you are taking systemic enzymes, make sure they're enteric coated. We don't want these to get broken down in the stomach. Then they become digestive enzymes and they break down food. So taken on an empty stomach and enteric coated, excellent for acute inflammation with swelling. Chronic inflammation is a different story. There I like ProEnz by Anabolic Labs. ProEnz is all herbal. Ginger, rosemary, boswellia, frankincense, herbs that reduce inflammatory markers in your body. They're COX-2 inhibitors, like a natural Advil, so to speak. Gentle, you can take them with or without food, and it mitigates, it reduces the inflammatory response in your body. Take it every day is what you do this for, the ProEnz, everyday use. The Xymane is usually just a couple of days, 5-6 days when you're acutely inflamed. Some of my patients take it on a regular basis after a hard workout or something. You can do that as well. So you have acute inflammation, Xymane, you have chronic inflammation, ProEnz. Together, it helps control inflammation, which is an itis, which is an osis, which is neuritis, gastritis, diverticulosis, arthrosclerosis. It's everything. It's pain. So you need to suppress inflammation for chronic disease as well as for acute injury. That's how we do it here in the office. Let me know if you have any other questions.
I started coming back here to Fabio because I was experiencing a lot of pain with sciatica, and it was time to resume my relationship with Dr. DeFabio. I came back and experienced not only Dr. DeFabio, but also the two new assistants, and what remained constant is just the care and the concern, and that I wasn't being rushed in and rushed out. And I think that's one of the reasons that I came here. I've never been to another chiropractor, but that makes a difference to me. The culture here is a good, positive one, is a good one, because immediately, as I've experienced even with medical doctors, I get a certain amount of time and that's it. And here I was evaluated, a lot of time was spent with me to determine my whole body and what needed work, what needed adjustment. And I, as a Catholic priest, like to give the same type of service to my parishioners and to people I don't even know. It's wonderful to receive it back. A lot of time to reflect, because between sitting in the chair and getting stimmed and stretching out my body a little bit more is all part of the therapy. A lot of time to really reflect and say, you know, I'm coming here originally 3 days a week and then 2 days a week, and realizing, like, you know what, I'm dropping my body off here, and there's a certain unconscious expectation that they're gonna fix me, and realizing, you know what, I need to be a part of the solution. So that's some of what I've taken in, and helping watch the YouTube videos certainly sparked my thought process as well. Back in November, I chose to make some differences in my life. And I know Dr. DeFabio talks an awful lot about anti-inflammatory, and it's, you know, when I first started coming here years ago, it was all good stuff and nice words. And as I've been reflecting, it just made sense to me that I needed to start doing something different. And so I chose back in November to radically decrease the amount of sugar I was taking in and radically decrease the amount of alcohol I was drinking. Not that I was excessive in either one, but it was doing enough. And so those, and consistently going to the gym as well to make sure that I was doing what I could do for my body in addition to the nutrition aspect. When I recently went to see my medical doctor, I got on a scale and I was weighed, and I was told that I lost 18 pounds. Now I was like, what? Now I knew that I had taken off weight because my clothes were fitting better, and I was really proud of that experience. But to actually hear that I had taken off 18 pounds was astounding to me. And I contributed to the three. Coming here, changing what I consume, and let me just add to that, eating more healthy, eating the right things, in addition to eliminating the things that could cause inflammation, as well as working out. I suggest that for people who are on the fence about chiropractic, if you've not experienced it, then at least give it a shot. If you're having some issues with your body, give it a shot. You can't make a decision about something that you haven't experienced. And so I try to do that in my life. I like to be informed. I can't just based on what others may say or what I've heard. I need to take care of myself. And I know that because of the care and the concern that I've experienced here, that this was the place that I wanted to come. Mm-hmm. I'm grateful. I feel like when I come here that I'm known, and I know that with being clergy, people like the experience of being known, that it's not an anonymous experience. It's not just the insurance and coverage and all that stuff is important. But feeling that I'm known, that what ails me at times is known, and that I'm cared about. And that's why I come here.